Hi everyone, good evening. It's Pratibha here today for the live session with Dr. Masooma regarding the spine health. And today Richa is not available. Richa is occupied somewhere else. So today I'm taking in charge on her behalf to help you guys regarding all the questions whichever is coming on your mind for the physiotherapy or regarding your spine health or regarding any sort of things. I'm gonna help you today. So we are connecting Dr. Masooma as soon as possible, and I hope that this session will be very helpful for each and every one of us, and everybody will get few answers of their questions as well. So I'm just waiting for her to join back, and it's gonna be a great session, at least for those who have the suffering of all kinds of pains regarding knee, joints, spine, neck. 1 to 2 minutes. I'm just waiting for her, so let's wait for her. Hi, Dr. Masooma. How are you? Good evening.
Hello, good evening. Can you see me? Hello?
Yes, I can see you very clearly. Are you able to see me?
Yes, I can see you.
Perfect.
How are you doing?
I am also good. How about you? I think today is already Sunday, so everybody is in chill mode.
Yeah.
Yes. So Richa is not there. Richa usually takes the interviews every week, but this week I am there because she is actually stuck somewhere else. But as I informed everyone that today's session is going to be very helpful because we have a specialist who will help us regarding the spine health or whatever. Masooma, are you able to hear me now? Because of some network issues, the call got disconnected.
Yeah, I can hear you.
Yes. So I was just saying, मैं बस छोटा सा एक introduction ही दे रही थी कि because of today's call, so many people are going to get their answers regarding any sort of pain, क्योंकि बहुत सारे लोगों को ये problem होती है कि जैसे हमारा वर्किंग प्रोफाइल ऐसा होता है कि हमें पूरा दिन काम करना होता है, या लेट्स से हम हॉस्पिटल इंडस्ट्री की भी अगर हम बात करें तो हमें पूरा दिन पेशेंट्स को केटर करना होता है, पेशेंट्स के रूम पर अवेलेबल होना होता है,
Definitely.
और मोस्ट ऑफ द टाइम वी हैव टू स्टैंड. और अभी तो फिलहाल कोरोना की वजह से तो और ऐसा सिचुएशन हो गया है कि आपको ना चाहते हुए भी आप हर जगह बैठ नहीं सकते हो. यू कैंट टेक रेस्ट, यू कैंट पॉज द वर्क व्हिच यू आर डूइंग.
Exactly.
So I am gonna get a lot of questions for sure because ये बहुत common problem है सबके लिए. Because even if I'll say about myself, yes, I also feel some sort of back pains and all, which is actually very common.
Yes.
So
Yes,
today we are gonna
yes.
get a lots of questions, and I am so happy that at least many of the questions will get answered by you because you are the specialist for that. You are handling all those questions on your day-to-day life, and yes, it is gonna be helpful. So if you have anything which you want to just let everybody know what exactly we are doing wrong, just a general thing कि आप क्या अपने लाइफ शेड्यूल में गलत करते हो जिसकी वजह से आपको ये बेसिक पेन्स हो सकते हैं, या उसका कोई रेमेडी है आपके पास या कोई सॉल्यूशन, सो दैट विल बी वेरी हेल्पफुल.
Yeah. Okay, so let me start with my introduction. I'm Dr. Masooma Rehman. I am physiotherapist of Ulok Delhi, right? And thank you so much for having me today with you. Regarding any form of back pain or neck pain or general, spine health, आजकल बहुत common है, very prevalent. In fact, not just right now, बहुत पहले से बहुत common है, right? Because what happens is very little things add on to the pains, the straining and stressing of the muscles, which we do not give a lot of importance to, and बाद में जाके ये सारी चीजें बहुत ज्यादा excessive में बढ़ जाती हैं, right? Also, it so happens that initially you might feel that the pains and aches are towards a very milder side. You ignore them, right? After that, what happens is once you start ignoring the pain altogether, it would become a long-term and major problem, right? What happens is for some time you feel that the pain is there, फिर कुछ time के लिए ठीक हो जाता है. ऐसे करते करते the muscle and the spine is getting a lot of load, taking a lot of pressure, taking a lot of strain. In that case, what happens is it builds up, and building up very in a less manner and then going up to a certain degree, what happens is in that case it becomes a serious situation in which long term management is required, right? So today what will we discuss is very small things that will help you with taking care of your postures, knowing your body, and how much daily activity is required, how to not strain your muscles, right? And also there are certain degenerative changes that happens at certain point of time. We have to understand them as well, because some people come to me and they say कि मुझे ये कभी नहीं हुआ, अब एकदम से होने लग गया है, right? So they have to understand that they are also aging, and certain factors contributing to that aging process and degeneration of the bones and joints, and how to take care of it in general, right? So we will discuss about all these things today, right? So first let's discuss about what all comes in back and neck pain, right? What are the factors affecting the back and neck pain? So first thing that I would start with is the sedentary lifestyle that is people are having nowadays. Okay, we'll start from a child, right? Nowadays the child is not into too much of outdoor activities. जैसे हम बाहर खेलने जाया करते थे, 6 बज गए मतलब बाहर खेलने जाना है, that is not there right now. That is not what the children are doing. Okay, so they are very much satisfied with whatever is going inside the TV, or they have their gaming stations, and they are happy and satisfied with that.
Correct.
Right. So nowadays the children are not also interacting and not going to play outside. The entire scenario has changed from when we were younger, right? So I would say that sticking to a certain position for a very long time, just watching television, gaming, using just the remote control and sitting in a chair and gaming, also being not very active, bachpan se hi some things starts and then builds up. Right. So it is very important even for the children to be active. Right. So what I would say is sedentary lifestyle comes from when in which family the person is born, also how much active everyone else is, because the child will only follow whatever is going inside the house, right? So if everyone is active in their house, then the child would also know to be active. So what happens is when the person is adolescent, these days because of increased pressure in the school as well, college school भी जाना होता है, ट्यूशंस भी जाने होते हैं, दे आर होमवर्क भी करना है, या सो दे डोंट हैव टाइम टू गो एंड प्ले, और जितना टाइम उन्हें मिलता है दे फील लाइक कि टीवी के सामने निकाल दें या फिर गेमिंग के सामने निकाल दें. Phones are a big thing. Giving cell phones to kids is a big thing which we cannot avoid, because it is such कि सब जगह ऐसा हो गया है that all the kids are getting cell phones. So if you don't give your kid the cell phone, he would feel like कि I am being restricted to something. Yes. So we cannot avoid these things, certain things, but definitely we can make a lot of difference by doing small things, right? So because of sedentary lifestyle, also in a working age now, certain job profiles are where you have to be in a certain position for a very long time, right? So it has been like that for a very long time as well. ऐसा नहीं है कि अभी से start हुआ है, but also because of this pandemic situation, everyone is hooked up to their screen and sitting for a very long time. They don't get breaks. So what happens is this sedentary lifestyle also adds on to increase weight.
Correct.
Obesity and overweight in people, right? So what happens is when a person is overweight, it puts a certain pressure on their spine. Okay, so because of the pressure that has been put on the spine, when it's for a very prolonged period of time, if the person has been overweight for a very prolonged period of time, then they develop certain pains and aches, right? So then we can talk about postures. So what happens is there is a usual normal posture that a person attain, but because of less strength and not exercising much, they tend to go into a slouched posture or a very relaxed posture, right? So what happens when the person goes into a slouched or a relaxed posture? जब वो इस posture को attain करते हैं तब तो उन्हें बहुत comfortable लगता है, but when they continue in being in that posture for a very long period of time, then it creates problem, because it is not the right and the correct posture for the body. So the muscles are getting strained, muscles are getting, either it's in a contracted form or it's in a elongated form. Elongate होता है तो उस पे strain पड़ता है, contract होता है तो उस पे stress पड़ता है, right? So in any form, if the muscles are getting laxed or contracted for a very long period of time, then definitely the person is going to have pains and aches. So we will be talking about how to correct the postures, but right now we'll just go through what are the factors that affect the postures, right? Then okay, then is what you call degenerative changes, like I was talking about. So what happens is once the person reaches the age of 20, we say that certain degenerative changes starts happening. Okay, 20 is the age when the person is growing. After the age of 20, then the degenerative process starts happening. So जो 20 से 30 का age है, that is basically when you should be good, maintaining good activity, so that at that time, if you are active, generally doing every work, usually people are around their college age, so they are active, say they are good, and they maintain their good health. So what happens is once you come into your work life, your office life, then what happens is there is increased stress.
Yes.
There is increased responsibilities, right? There is increase because you have deadlines you have to complete. There is less stress, less physical activity. You are more focused into just the working and working. So what happens is, in this case, because of stress also, there is a lot of mechanical stress that is put on the muscles that the person does not realize for a very long time, right? Until and unless a person starts having pain, they do not think of how I should taking care of certain postures of my lifestyle, because until and unless they face some issue, they are like, this is how I have to do it, right? So they do not. So what I am trying to say is that it's very important for prevention. If you give importance to your prevention aspect first, then definitely you are going to stay away from a lot of pains and aches. But if you are having these pains and aches, then you have to understand that there's no magical solution to anything. If you are taking some physiotherapy, or if you are going for certain exercises, it would take a lot of time for you to come to your original state. Maybe 3 to 4 या एक हफ्ते में you might see some changes, you might feel good, but to entirely come towards what you were before, you would need some time, because जो process आपका हुआ है, the strain and stress that you are going through, जो प्रोसेस अभी हुआ है, दैट इज हैपनिंग फ्रॉम अ वेरी लॉन्ग टाइम. तो उसको रिवर्स करने के लिए भी वी हैव टू वर्क ऑन इट, एंड टाइम लगेगा. सो people have to understand that going through a physical therapy always, any therapy always requires time. There is no magical solution for it, right? Okay. Then we'll discuss about what are the strains and stresses in our work, right? So
Correct.
what happens is, for example, the person who is in a sitting job. We'll discuss about a person who is
Actually,
in a
I was
sitting job.
actually had that question in my mind only regarding this sitting job. Reason being, जैसे आपने मुझे बताया अभी, मतलब जितना हमारा discussion हुआ, I think I just got three things. I realized three things basically. One is that there are three phrases which is very common, जो हमारे बड़े हमें हमेशा बताते आते हैं. That is that childhood is the best time, जहाँ पर आप हमेशा enjoy कर सकते हो. आपको किसी चीज का stress नहीं होता है, कोई tension नहीं होता है.
Exactly,
Then
exactly,
regarding your health also, वो जो चीज है वो शायद अब हम relate कर सकते हैं. And the
exactly,
second thing which you mentioned is that yes, for sure healing is a slow process. अगर आप किसी चीज को ज्यादा टाइम लगाकर अगर आप बिगाड़ रहे हो तो उसे सुधारने में भी उतना ही टाइम लगेगा. So
definitely,
that is
definitely.
for sure. And yes, even I had few questions जो viewers भी हमें दे रहे हैं. That is again because मैंने आपको इसलिए रोका था क्योंकि जैसे ही हम sitting वाले job पे जा रहे थे, the first question which raised is the same thing कि what is the disadvantages, क्योंकि जब हम sitting job में होते हैं हम बहुत लंबे समय तक के लिए बैठे हुए होते हैं. So
Yes,
sitting for a long hours, either for work or for anything else, how does this affect our spine and how can we reduce that effect a little bit? क्योंकि बैठना तो है, अगर आपका सिटिंग का काम है, you can't deny that, क्योंकि जिनका 9 to 6 का आवर्स है उन्हें बैठना ही पड़ेगा. बट ऐसी कौन से टिप्स या
exactly.
ट्रिक्स हैं जिसकी वजह से वो शायद उनका वो जो इफेक्ट बहुत जल्दी दिख रहा हो उनकी बॉडी में, या अगर किसी को पेन हो तो वो उसको थोड़ा सा रिड्यूस कर सके. सो दैट इज द फर्स्ट क्वेश्चन व्हिच आई गॉट. सो आई थिंक नाउ दे कैन गेट द आंसर ऑफ देयर क्वेश्चन एज वेल. सर
Yeah, yeah. So, see, sitting for a very prolonged period of time has been shown to put 300% more pressure on the spine. Okay,
ओके.
so usual pressure से 300% more pressure होता है if you sit for a very prolonged period of time. So a person who is in job, जिनके job requirement is sitting for a very prolonged period of time, doing it for 8 to 10 hours for 5 days a week, right? So बहुत ज्यादा है ये. It's too long for a person to being in a position for a very long period of time, right? So in that case what happens is spine पे pressure तो पड़ ही रहा है, muscles पे भी pressure पड़ रहा है, right? So certain muscles get elongated because एक position पे आप बहुत देर तक नहीं बैठते हैं. You sometimes change your position, you either slouch, you take lean on your hand, on different positions you take. But towards the back, when you are sitting toward back, वैसे का वैसे ही rested होता है. It's sitting on one thing and it's sitting there for constant time, right?
करेक्ट.
So back has the maximum amount of pressure when you're in a sitting job, right? So what we need to do to take care of all these things is, first, anything that is important is, first is work environment कैसा है, how is the things that you're sitting into, how are they positioned, and how is your posture, right? So I'll tell you a little things that would help you with the improving in your work environment, right? Because we have to sit for a very long period of time, glued to a screen, glued to a computer or a cell phone, right? So what we need to do is first take care of our postures and how to align the things around us, right? So what we do is, first is we have to have a desk which is aligned to our height. Okay,
ओके.
ज़्यादा ऊंचा भी ना हो और ज़्यादा नीचा भी ना हो, right? It has to be aligned to our height. Then we go for a good chair. Chair should be, it is best to have an ergonomic chair. If you feel like that office environments sometimes do not provide you with ergonomic chair, so you can do some जुगाड़ कर सकते हैं, right, to have a good
हाँ.
position. All we can always do
ओके.
that, right? If we want to have a good health, we can always find solution for ourselves, right? We just have to have the
डेफिनेटली.
right knowledge, right? So what I'll say is, having a chair, and have a small thin pillow between your seat. So the back is has a little curvature towards the end, right?
Yes,
So we
yes,
can
yes.
have a very small thin pillow around our that curvature, so that it has to be a small thin pillow, not a uh, mota pillow nahi hona
हाँ,
chahiye.
बहुत
It
सारे
should
लोग
be a
ऐसा मोटा
small
मोटा
thin.
पिलो लगाते हैं, करेक्ट, दैट इज रॉन्ग.
Yes, yes. हाँ, that also change the posture to a slanting position जिसमें pelvis inclined हो जाता है, and that is not a good posture. So
करेक्ट.
you have to have a small thin pillow, so that your the pressure that spine is taken is evenly distributed from top to bottom, right? If you don't have that pillow, the pressure is towards the upper spine and towards the lower spine. But if you put the pressure, if you put the pillow in, तो evenly pressure distribute हो जाता है, right? So first thing is use a good pillow. Then your जो armrest जो होता है, have a good armrest, so that your what do you call, your upper arm and your spine is in parallel, right? You have to have your upper arm and your spine in parallel, and your elbow in a 90-degree position.
ओके.
Okay.
ओके, सो दैट
Yeah.
मीन्स इट
And
हैज टू बी
also,
लाइक दिस.
yes, yes. And also the armrest should be a little raised, so that your shoulders are a little raised. If it goes downwards, then there are chances of slouching the shoulders, and that is also a bad posture, right? So always have a raised armchair, armrest, so that you keep your hands and your shoulders a little raised, right? Also, take care of your joints. Your knee joints should be 90 degrees, and your ankle should be planted on the ground. It should not be hanging. If you
ओके.
have hanging ankles, what happens is after sometimes you'll develop ankle stiffness, and you'll have some swelling, edema,
करेक्ट, करेक्ट.
right? So yeah, so that is the entire posture of the body. Then towards your desk, you should be having the screen or your phone aligned to your eye. So how will you know what is the right alignment to your eye is? Close your eyes, and then very slightly open it and see in which direction you are seeing. Okay.
ओके.
When you open your eyes, you have to see in which direction you are looking. That is your resting eye state, right? And that should be the where your screen should be, so that you don't have to either take your neck down or up. So taking your neck up, down, and sideways would create a lot of strain.
Yes, for sure.
Yeah, yeah. So when you are sitting in an upright position, you have to see where your eye level is, and try to have place your desktops or your laptops in that position. That would be beneficial for you, right?
ओके.
So this is regarding all the postures related to sitting position. Now we'll go to standing, prolonged standing,
सॉरी फॉर
right?
इंटरप्टिंग, बिकॉज बिफोर स्टैंडिंग वाला चीज है ना, बिकॉज आई जस्ट गॉट 2 क्वेश्चंस, तो वही मैं बताना था, क्योंकि व्यूअर्स ने 2 क्वेश्चंस और पूछे थे, जिसका आंसर आई थिंक
Mm-hmm.
उनको इस पूरे डिस्कशन में ही मिल गया, क्योंकि एक तो था कि सिटिंग जॉब वालों को क्या करना चाहिए. सो सिटिंग जॉब अफेक्ट करता है या नहीं करता है रिगार्डिंग स्पाइन, तो उसी में ही 2 क्वेश्चंस मेरे पास और आए थे. तो आई जस्ट वांटेड टू इन्फॉर्म देम कि हाँ, आपकी जो 2 क्वेश्चन आते हैं, वन दैट व्हाट इज द रेमेडी व्हिच वी कैन फॉलो फॉर द सिटिंग जॉब, वो ऑलरेडी आपने इतने अच्छे से उन्हें समझा दिया कि अब शायद अब सब कोई वो एक थिन पिलो के अरेंजमेंट में लग जाएंगे जिनका 9 to 6 सिटिंग
Yeah.
आवर्स होता है, दैट इज फॉर श्योर.
Yes.
And secondly, I think none of the companies must be aware of this very little tiny thing which you have informed कि अच्छा आपको आंख बंद करनी है, and then आप आंख खोल के जिस तरफ देखते हो, that is your perfect resting position for your eye, which will also help your spine. So this is something which even I have never heard of, and I guess कि आज के बाद बहुत सारे लोगों को ये पता चल जाएगा, और अगर नहीं पता चलेगा तो हम उन्हें जरूर बताने की और कोशिश करेंगे that this is the thing which you have to follow for sure for the sitting job. तो एक तो उनको ये आंसर मिल गया, आई गेस एवरीबडी हैज गॉट दिस आंसर कि क्या रेमेडी हम फॉलो कर सकते हैं, एंड सेकेंडली कि हम किस किस पोजीशन में बैठते हैं जिसकी वजह से हमारे बैक पेन्स में इशू आते हैं, और उनके लिए हमें क्या करना चाहिए. सो दैट इज the thing which everybody must be aware of. स्टैंडिंग का भी मेरे पास अभी एक नेक्स्ट क्वेश्चन आया था कि व्हाट अबाउट द स्टैंडिंग जॉब मैम. ठीक है, सिटिंग के लिए तो बहुत सारे लोग बातें करते हैं कि ठीक है, सिटिंग जॉब तो आपके स्पाइन को अफेक्ट करता ही है, Hello, Masooma, are you able to hear me now?
Yes, yes.
Yes, I think network का
Yeah.
कुछ तो issues है. So yes, I was saying कि जैसे
Yeah.
डिलीवरी वाले एग्जीक्यूटिव्स हैं या let's say हॉस्पिटल स्टाफ में GDS स्टाफ हो गया या आपका क्लीनिंग स्टाफ हो गया, सिक्योरिटी गार्ड्स के स्टाफ हो गए, इनका जॉब हमेशा 24/7 या 12 आवर्स का जो उनका शिफ्ट होता है उनको खड़े होने वाला ही जॉब होता है.
Yes.
सो
Yes.
वो हमेशा यही चीज बोलते हैं कि हमारे लिए कोई कभी आगे बढ़कर नहीं बताता है हमको, क्योंकि हम भी खड़े होते हैं, हमारे भी बॉडी में इफेक्ट करता है, दैट इज फॉर श्योर. तो बट लोगों के माइंड में ये मिथ होता है standing job will affect your feet or leg and sitting job will affect your back. So I think now this is the opportunity for us to inform everybody कि नहीं, standing job से आपके back में भी problem होता है और वो क्यों होता है. I think you will be the best one to inform and it's remedy as well कि अगर कोई खड़ा है तो वो क्या ऐसा कर सकता है जिसकी वजह से कुछ हद तक उसके effects कम हो जाए.
Yeah. So, like we discussed about the sitting job, similarly, standing job for a very prolonged period of time also have a lot of effect, right?
Yes.
Because किसी भी position में, if you are being for a very long period of time, see, because we are talking about jobs, so jobs we do the most of the period of our life, right? So it is, like I said, 8 to 10 hours for 5 to 6 days, है ना? So any position that the person is attaining for a very long time will create some problems, right? Until and unless they are being active in their positions, right?
Yeah.
So if, for example, we're taking a job that is done by a guard, right? So he has to be standing for a very prolonged period of time and greeting people and attending to people's need, right?
Yes.
So what happens is, if you are standing, like we have all experienced, if we walk for a very long time or stand for a very long time, we have backaches.
Yes.
We start straining our back. So imagine for a person whose job is standing for a very long period of time, right? So definitely they, because of increased stress on their joints and increased stress on their what do you call vertebrae, there is a lot of pain that can happen. So what we can do is, we can ask them, for anyone, I would suggest, even if you're if you're having a sitting job or a standing job, have a 30 minutes exercise routine daily नहीं भी होता है तो try doing it five days a week.
Okay.
30 minutes, ज़्यादा करने की जरूरत नहीं है. We can either do cardio exercises or strength training exercises. So in the entire day, सब लोग सब कुछ कर सकते हैं, बट 30 मिनट्स की एक्सरसाइजेस के लिए भी टाइम निकाल सकते हैं, राइट? यू हैव टू बी वेरी डिटरमाइंड टू start doing it, right? It has to be, the protocol has to be such that you start with some milder form and then you go to intense exercises, but start with 30 minutes of exercises, right? Now when you are in a standing job and you are standing continuously for a very long time, uh, have a stool somewhere where you can, in between, take breaks every 2 to 3 hourly. When you see that it's a little lighter, you can sit and take breaks, right? It Yeah, you have to be aware of the thing that you've been, because some people get so immersed in their job that they forget little things. So you have to be aware about this thing, that you have to take breaks in between, even for a standing job, even for a sitting job, right? So even if you are sitting for a very long period of time, I would suggest you get up and you walk a little, take 2 rounds of your floor. Okay, it would take just 5 minutes. 5 minutes में
Sorry.
Yeah.
Yes.
Hello. Can you see me?
Yes, I can. I think there is some
Yeah.
issues, whichever happens.
No problem. No problem.
Yeah.
Yeah. I'll just continue. So I was saying that if someone has a standing job for a very long period of time, make sure to take your breaks, right? Already, And also there are certain stretches that I recommend for everyone. Certain neck stretches that you can do, certain bending forward stretches you can do to release all the tensions in your muscles and your entire body. This would help you in continuing with your work and make you a little refreshed,
Correct.
right?
Correct.
So the amount of breaks that one should be minimally taking in between their work is, in the morning you should have one break, in the afternoon you should have one break, and in the evening you should have one break. 10 minutes ka, 5 minutes ka, however you feel comfortable, right? So that can be done, uske liye koi mana nahi karega. But
Correct.
what happens is, the thing is ki the person should be willing to do it, and the person
Correct.
should realize that I have to do these certain things to prevent what can happen to my body,
Yes.
right?
Yes.
So
Yes.
there are certain office stretches that is recommended, very little small stretches that you can do for your entire spine, bending down, right? Bending sideways, okay, then taking your neck towards the side and
Yes.
stretching the neck, making the stretch, making the neck mobile by rotating the neck, and also rotating your pelvis entire circles, walking a little. All this little and small things would help you a lot in the long run,
Yes.
right?
Correct.
Yeah. So these are all the things that we can do in a standing job to prevent. Yeah.
Correct.
Yeah.
Correct. Awesome. Thank you so much, Masooma, because there will be so many people, especially like the people, जैसे आपने भी mention किया, like guards and GDS staffs, they must be
Yeah.
very happy क्योंकि उनको भी एक चीज समझ में आई होगी कि ऐसा नहीं
Yeah.
है कि sitting में ही affect करता है, standing
Exactly.
job में भी affect करता है.
Definitely. Definitely.
सो आई थिंक नाउ फ्रॉम नाउ ऑन हर कोई ये इनिशिएटिव निकालेगा दिन में कम से कम 3 बारी 5-5 मिनट का ब्रेक लेकर के दैट स्ट्रेचिंग एंड ऑल दे विल डू बिकॉज आई विल
Yeah.
पर्सनली डू दैट इज फॉर श्योर
बिकॉज चाय ब्रेक निकाल सकता है कोई, तो अपनी हेल्थ के लिए भी
करेक्ट
निकाल सकता है.
correct I
Yeah.
completely
Yes.
agree I completely agree so I
Yeah.
think from now
Definitely.
on we will give that motivation to everybody that you have to take out time at least for 5 minutes every after 3 to 4 hours. So yes, I just had one question with one of the viewer, that is that how does this sleeping postures और लेट्स से डूइंग सम अदर काइंड ऑफ थिंग्स, जैसे बहुत सारे लोगों को मैंने देखा है वो अपने हाथ ऐसे क्रैकल करते हैं या फिंगर्स ऐसे क्रैकल करते हैं, हाउ डज दीज अफेक्ट्स योर बॉडी और एक पर्टिकुलर जॉइंट पेन, और फिजियोथेरेपी उसमें कैसे मैनेज करती है या कैसा वो मैनेजमेंट होता है जिसकी वजह से वो आपको हेल्पफुल करती है, या फिर हमें कब पता चलेगा कि अच्छा ठीक है ये अलार्म है, अब मेरे यहाँ पर अगर पेन हो रहा है किसी जॉइंट में, आई हैव टू सी दैट फिजियोथेरेपिस्ट के पास मैं जाऊं और टाइम निकालूं. So I think yes, I have mixed 3 questions. That is sleeping postures, and secondly how to manage some other activities जैसे finger वगैरह crackle करने का है, and thirdly हमें पता कैसे चलेगा कि अगर हमें कहीं pain हो रहा है तो it is an alarm कि फिजियोथेरेपी को मिलना बहुत जरूरी है.
Yeah. So let's start with the first question. That was, what are the certain sleeping postures, or what we can use while sleeping, the mattress or the pillow. How can we use it in certain ways that you have a correct posture, and it doesn't provide a lot of stress and strain on your spine. Okay? Because certain times it happens कि सो के उठ के फिर लगता है कि पेन ज्यादा हो रहा है, right? It happens certain times, right? So
Correct.
what we can for it, I would say that there are 3 types of posture that we take while we are sleeping, right? First is straight lying posture,
Yes.
सीधा जिस पे लेटते हैं, ठीक है. देन इज साइड लाइंग पोस्चर, साइड में जैसे लेटते हैं. एंड देन इज लास्टली इज योर lying on your stomach,
Stomach.
right?
Yes. Yes.
बहुत कंफर्टेबल फील होता है लोगों को भी when you lie on your stomach,
I
right?
completely
So
agree because मुझे भी होता है.
yeah, but that is the worst position.
Yes. That was only I
Yeah.
wanted to
So
listen. So
yeah,
yes.
yeah. So why I don't recommend anyone to lie on their stomach is because it puts your neck in a lot of stress and strain, right? Because the neck is not in a supported position, right? It gets a lot of strain, and also your shoulders, necks, all of this are interconnected. Once the pain starts from your neck, it goes to your back, then neck affects your shoulder, affects your elbow, affects your hand. So every joint is interconnected. Problem ek jagah se shuru hoti hai, and that, goes to different areas. So
Yeah.
it is not recommended for you to lie for a very long time. I'm saying, if you want to lie for a little, a specific amount of time on your stomach, it's okay. But lying for a very long time, because once you go into sleep, you do not have the idea of how long you've been in that position. So
Yes.
if you're going to sleep in that position, then I would suggest that it's not a very good position to sleep in, because you might develop neck aches and shoulder pains and hand pains, right? So coming to the other two, the first one, like we discussed, was straight lying position. Yeah, so what we need to do is understand that when a person is lying straight, again the same thing applies, that they have a little curvature in their back, right?
Yes.
So उस curvature को सीधा करने के लिए we'll put a small thin pillow on our knees. Will
Oh,
place the pillow on your knees. When you bend your knees a little, the spine gets flat,
okay.
completely flat. Yeah. So when the spine is completely flat, then it is in a rested position. Okay. So we'll place a small thin pillow on your knees, so that you are in a comfortable rested position. If you want to sleep in the straight lying position for a very long time, I would recommend to have a small thin pillow on your knees, right? Okay. Now coming to the side lying position,
Yes.
right? When you are in any side lying position, I would suggest that you have a pillow between your knees. Why? Because it reduces the stress or strain caused by the hip joint and the knee joint, right? So if you have a pillow between your knees, it aligns your spine, and it reduces the pressure around your hip joint and your knee joint. So anyone who uses a pillow around their knees is a good posture. Okay?
Oh,
So if you feel comfortable using pillow around your knees, and that is a good posture, I would recommend, right? Okay,
awesome.
now coming to what kind of pillow you should be using when you
Yes.
are sleeping, right? So there is every person has a different perception of how a pillow should be. सबका अलग अलग होता है कि someone uses a very thin pillow, किसी को
Yes.
बहुत है, you know
मोटा चाहिए
they
होता है.
use 2 to 3 pillows इस तरह से.
Yes.
Yeah. So everyone's comfort level is different. ठीक है, comfort level से हम original posture को नहीं मिलाएंगे. ठीक है, so
Correct.
everyone's comfort level is different. Comfort level के लिए you can have that posture for maybe sometimes when you are watching movie, or you're just lying down and chatting to your friends, or just generally doing some work. So comfort posture के लिए वो सब ठीक है, but to have a good posture, you need to have a pillow which supports your neck, curvature of your neck. So our neck also have a little curvature, right?
Yes.
It has a little curve. Okay, so we have to have a pillow that is not very firm and not very soft, so that it can take the curvature of the entire spine, right? So that it can support the neck, the curvature of the neck, or what we call the cervical spine, right? So we have to have a pillow that supports the cervical spine. If you are lying in a straight lying position or in a side lying position, if you have a good pillow that supports your cervical spine, then you are good to go. Then your spine is in an alignment, and you will not have too many problems, right? Now coming to the mattress, how a mattress should be used. So when I have seen people saying that if you are having back pain, तो नीचे सो जाओ, एक
हाँ,
चादर लगाओ
correct.
और नीचे सो जाओ, right? So
Correct. Correct.
having too soft of a mattress or too firm of a place in which you are sleeping, both are in a long term, both will give you problems, right? So what we need is the exact amount, और ये जो exact amount है वो for every person it is different. Every body, every individual is different. So that exact amount, just you need to have the knowledge that I do not have to, sleep in a very soft bed. So very soft bed पे क्या होता है? It makes a hammock effect. So the spine goes down. Right, the spine goes down. It's not in a straight line position and it's not in an alignment. So सोने में तो बहुत अच्छा लगता है in spring mattresses and very soft mattresses, but you will develop backache after some time. Also, if you are lying down in a very firm mattress or a very firm place, like when someone is sleeping on the ground, so in that case what happens, spine to align ho jata hai, but there's a lot of pressure on your shoulder, neck and your hip, right? So all of this pressure creates different problems in different joint again, right? हो सकता है कि spine उसमें बच जाए, लेकिन your shoulder, your hip, your तो restless leg syndrome भी होने लगता है. If you lie down in a certain position in a firm surface, what happens is you start feeling having restlessness in your legs because pressure बहुत ज़्यादा होता है. Certain structures are getting compressed, so you feel that restlessness, right? So all these precautions, all these knowledge you can take and you can apply it in having a good and alignment of your spine, right?
Correct.
Then coming
I
to
guess
your
from now on everybody will be very happy और हर कोई अब अपने अपने comfort के हिसाब से mattresses और pillows दोनों ही purchase करने वाले हैं, because yes, that plays a very vital role on your sleeping habits, plus the pains which you get once you wake up in the morning. So it is going to be very helpful, that is for sure. So even we are getting a lots of questions, I think we'll have to answer them a little quickly because हर किसी के बहुत सारे questions हैं. As I mentioned, it is very common problem. So सबके questions आ रहे हैं मेरे पास अभी.
All right. Okay. So starting for the crackling of joints. So it is so what happens in this is if the joint is in a certain state for a very long time, it certain gases collects in that joint. ये जो cracking वाला आवाज होता है, that is the popping of the gas that is from those joints. So there are chiropractors, there are people who manipulate your joint and release these tensions, and then you can feel relief. So you can, if you feel like you are having too much pain because on the joint, you can always get yourself assessed to some chiropractor. Go there and they will assess you and they will relieve you of all the excessive stiffness that you are having because of the accumulation of the gases in the joints, right? Okay. The last question was, I could not remember the last question you were saying.
That alarm that 8:30 गया physiotherapist के पास जाना.
Hi, yes. Okay. So see, once you start having a backache, starting में what happens is you have the backache and थोड़ी देर बाद वो चला जाता है. We have कुछ दिनों बाद it goes away. Then it comes again. Then it goes away. Then it comes again. Then goes away. At certain point of time में ऐसा होता है that the backache persists, right? So what you need to do is when you start having backache or you feel strain in your back, then only go to a practitioner and ask them to get yourself assessed, right? So what happens is majorly what I have seen is people calling me up and saying that I've started having backache, मुझे कुछ exercises बता दो. They don't understand the importance of getting themselves assessed. I have to ask them certain questions of what their entire lifestyle is, how their occupation is, how their muscle strength is. So I have to make a good assessment. Then only I can prescribe them exercises, right? Correct. So first thing is get yourself assessed. Also, you might require some investigations to be done. So if that is required, so वो तो assessment में ही पता चलेगा. If you require assessment investigations or not, MRI कराना है, X-ray कराना है, anything. So first you have to have that assessment. So according to the assessment, we will be able to identify the problem kahan se ho raha hai, the root of the problem, because a physical therapy is always getting to the root of the problem and starting working on it. Okay.
Correct.
So once we get to the root of the problem, we have to now see how much the pain is. पेन अगर बहुत ज्यादा है, then we'll advise them rest, and we use ultrasonic therapy that is helpful for healing of the certain parts, right? Then we use transcutaneous electrical stimulation that helps us pain relieving. Okay? So when the pain is too much, then we do not prescribe exercises. It is first, we have to control the pain. Pain कम होगा, then only we'll prescribe exercises. Otherwise what happens is, if you start doing exercises in your pain, जो muscle already load में है उसको और हम load दे देंगे, तो it would not help you definitely. Right? So we have to first let the pain, we have to first deal with the pain, then we will prescribe how to strengthen the muscles. Because when the person comes to us to get themselves assessed, we tell them what is their strength of their muscles. We have a this thing chart, and according to the chart we put them how the muscle strength is, right? So once we get to know what the muscle strength is, the pain has decreased, then we put them on certain exercise protocol. Now these exercise protocol is depending upon how the strength of the muscle is. So we start with mild, moderate, or good intensity, whatever is required for that person's muscle, right? So this is how the physiotherapy protocol helps. So once the pain come ho gaya, now we have strengthened the muscle. Now we will help them in making them aware of their postures. जो correct posture क्या है, right? When we tell them, सिर्फ एक करेक्ट posture बता देने से नहीं होता है. We have to make them practice that posture, so that it goes to their brain, and their brain signals that you are in a wrong posture. You have to be in the right posture, right? So practice after getting treated is very important.
Correct.
And then we say, once you have been through the treatment protocol, the entire physiotherapy treatment protocol, then you go, then we ask you to do certain lifestyle changes so that you can maintain that. You don't want to be coming to me again for the same problem, right? Yeah. So we finish the protocol by adding the lifestyle changes, and this is how physical therapy can help you with dealing with any form of pains and aches in your entire body. Yeah.
Thank you so much, Masooma, because I think वो जो लोगों के मन में डाउट्स होते हैं या एक मिथ होता है कि नहीं फिजियोथेरेपी मतलब बहुत बार जाना पड़ेगा और ये तो कंटिन्यूअस प्रोसेस रहेगा ही रहेगा हमेशा, हम ये रियलाइज नहीं करते हैं या हम ये कभी बिलीव नहीं करते कि फिजियोथेरेपी इज अ प्रोसेस विच विल हेल्प यू टू रिमूव और रिड्यूस योर पेन, बट यस वो कंटिन्यूअस
फ्रॉम द रूट कॉज.
Yes, from the root cause specifically, but yes, पर वो हमेशा वैसा तभी रह सकता है जब आप उस चीज को या जो प्रैक्टिसेस हैं या जो पोस्चर्स जैसे आपने बताया आप इन्फॉर्म करते हैं अपने पेशेंट्स को, अगर वो उस चीज को फॉलो नहीं करेंगे तो ऑटोमेटिकली वो वापस से आएगा और आपको वापस जाना पड़ेगा.
Definitely.
Correct. So I think from now on, yes, everybody should have to understand that yes, physiotherapy is going to help you to remove that particular problem from their root. But in order to continue to be healthy, you will have to follow all those practices or that tips which is been provided by your therapist. So, yep, there are still so many questions, Masooma, but I guess, yes, we'll have to continue on some other live session as well, because हमें कुछ questions ऐसे भी होंगे. I know that there are so many viewers जिनके पास और भी बहुत सारे question होंगे. So, I would request them कि आप हमें questions अपने drop करो so that we can again connect with such a lovely doctor regarding this main issues which is going on with, मतलब हर किसी के घर में कोई ना कोई एक ऐसा जरूर मिलता है जिसके कोई ना कोई पेन होता है.
Everyone around me, I'm telling you.
Yes, it is very common.
Yeah.
So I would request everyone to drop the messages on our comment box or normal Insta पे जाकर के भी questions drop कर सकते हैं so that we can connect you back again. And it was lovely talking to you. And I guess
it was an honor for me as well. Thank you.
Thank you so much, Dr. Masooma. And specifically, yes, it was my pleasure to have you on this conversation because मेरे बहुत सारे
Same here,
doubts clear
same
हो
here.
गए हैं. And
Yeah.
I'm gonna help बहुत सारे लोगों को from now on. And
Yeah.
thank you so much for your lovely time. And today Sunday. On the Sunday also you took out the time because hospital line में वैसे भी हमें एक ही 2 दिन छुट्टियों के लिए मिलते हैं. So it was our pleasure
Not
entirely.
not a problem
Thank
at
you
all.
so much. Thank you so
You're
much.
welcome. You're welcome.
My
You're
pleasure.
welcome.
Thanks.
Okay.
Bye.
Okay. Bye bye. See you.
See you.
Take care.
Thank you. Same to you. Bye.